morning, Professor Potapov and Professor Konovalov. Good morning, all officers and all friends. I'm very honored and very proud to be here in the famous Burdenko Institute, and especially I'm very honored to give this talk to honor my famous teacher, Professor Axel Perneczky. I will only give a few spotlights in a short time and have a last view into the future. Of course, we have to ask the question, why starting with a historical view? This is a question for everybody who is familiar with the brain, because memory is the basics of awareness and consciousness. And if we want to set a strong signal, a strong sign for the future, it is necessary to continue the mythos of innovation and creativity. Even it might be to continue the mythos of Professor Perneczky for our society. I want to, at this point, remember to the European Congress of Neurosurgery in 1991, organized by Professor Konovalov, which was impressing me very much and giving me a strong sign of quality. And I want to remember to the ISMINS Congress in China 2014, to which I refer with my lecture. Of course, our obligation as the pupils of Professor Perneczky and as the members of the society is not to bury the ideas of Professor Perneczky. This is very important, especially for the younger colleagues, to get to know who Professor Perneczky was. And this was the farewell talk in 1993 at the first Kongress on Minimal-Invasive Techniques in Neurosurgery given. And he said, my wish would be that we all meet again as soon as possible and to learn from one another. And this was a typical behavior of Perneczky. He was always able to learn from others. Well, this was somehow the start-up event, the first Congress on Minimal-Invasive Techniques in Neurosurgery, 25 years ago. And it started with an art exhibition. Then, at the same time, the first atlas book on endoscopic anatomy appeared, and endoscopy course had begun, which was taking place 2 times a year since a foundation and a new journal was created and founded, all in the same time. Perneczky was well known as an inventor and innovator and visionary. Just to mention the Perneczky clip or the min-op setting of endoscope instrument, but finally the setting of so-called exoscope. Perneczky was a passionate teacher. He founded a lot of formats of courses and lectures and hands-on. In the Mainz time with him, I think we had 8 courses a year. So he educated thousands of colleagues worldwide in minimal-invasive techniques. Perneczky also was an author and editor. You know all his famous major contributions, but also Perneczky was an artist and musician and a promoter of art. All his workshops and all his lectures had something to do with art. This was a very typical mental ability of Perneczky, and give him some concentration and some relaxation. But his personality I am not able really to describe. his personal character ident with the slogan of the second ISMIN in China 2014, sophisticated in skills with patient in heart. This was a slogan that is perfectly fitting to the character of Perneczky. Everybody who has worked with him knows this very much. So this is the last time when I saw him before he got ill, honored worldwide and known and recognized worldwide. And finally in 2010, Hector Velázquez, the chairman of neurosurgery in Guadalajara, Mexico, he made a very warmly goodbye session for Perneczky with the majority of his pupils. But Perneczky would not be satisfied if I would stop my talk here at the end of his life, rather than looking ahead into the future. So the question is, which are the roots of minimal invasive strategies and techniques? And I had two teachers, Mozart and Beethoven, of neurosurgery. They were completely different. I don't know two persons who are more different than Perneczky and Jaschkin, but what was the secret of their common excellence? The secret was the ergonomics. If you study the ergonomics of both ergonomics are perfect. In this way, Perneczky and Jaschkin were perfectly common. This is the ergonomic setting of Jaschkin, well known worldwide, the gold standard of micro-neurosurgery. The subarachnoid cisterns are the roadmaps of micro-neurosurgery. Many concepts and ideas are behind this, of course. But now look, this was the final ergonomic setting of Perneczky. Completely different working conditions. Completely different procedure, completely different mental situation. And the main idea was the keyhole is not an anatomical structure. The keyhole is a concept. This is a major difference, very often misunderstood. And the main contribution of the Mainz school, of the Perneczky school, was to develop neuroendoscopy to endoscopy-assisted micro-neurosurgery. That means combining techniques to compensate disadvantages. The microscope can be replaced by the endoscope in many cases. Paraendoscopic working technique instead of transendoscopic instrumentation. Standard approach became individual approaches, and this all led to an increased application spectrum for endoscopy. And very important for safety, the keyhole is intracranial. The keyhole became intracranial. This causes a lot of safety problems, which are not all solved even today. But Perneczky would also wish now, if he would stand here, that we look more forward. When we stand on his shoulders, we have to decide if you want to rest or if you want to go on, if you want to look further, and especially in which direction we want to look on his shoulders. So we have to evolve the keyhole concept, because focusing on the whole led to misunderstandings in the past. I think 20-year whole discussion is enough. We have to change. We have to change and come from the whole discussion to the discussion and the question about the keys. Which are the keys of minimal invasive neurosurgery? This concept could be named the MIN key concept. By the way, the most unknown key is the ergonomics. This will be very important for the future to discuss about ergonomics. So especially for the next generation, also for us, but especially for the next generation, is to look for the keys of minimal invasiveness. And one key is to have a strong society with a good future program, Another key is the ergonomics, as I have mentioned already, the ergonomic conditions of minimal invasive neurosurgery. And the third key, for example, is the mental conditions in working, especially in the imaging, which is getting more and more. What does it do? What does the working conditions do with the brain of the surgeon? This is the new question. The brain of the surgeon is the white spot today. So in the future, we will have a lot of new techniques, and we need a lot of new effector systems. This was the final setting which Perneczky used, head-mounted display and rotator arm for the optics. He called it exoscope. The new systems must be integrated systems, and they must be intuitive and modular and cheap. And we will have new fields in neurosurgery, the minimal invasive neurosurgery, the electronic neurosurgery, and the biological neurosurgery. For all these fields, we need new effector systems. They must be easy to use, and they must be simple, and they must be cheap. So we have a program, but this is not very new. Minimal invasive idea is not so new. At this place, at the Burdenko, I think this is the right place to say that the necessity to minimize the surgical trauma was already talked about and written about by the Russian neurologist Resch in 1907, not 2007, 1907. Resch from Russia wrote about this problem and asked the neurosurgical colleagues to be more elegant and more minimal and more less traumatic. So we have a program, we need to have a program to include additional fields and techniques which we should consider. For example, as I mentioned, ergonomics, head-mounted system, ultrasound laser, OR suite design, but also new sciences. Minimal psychoneuroimmunology will be very important in the future, and training methods. Which kind of training methods will we use? Training does not mean to have a schedule. Training means you form the brain of the young neurosurgeon. This is training. You have to understand about the brain of the surgeon himself. We have to understand the mental resistance in medical evolution. This is what minimal invasive working colleagues have every day, a mental resistance in evolution of medical development. And we have to understand the neuropsychology of the surgeon's brain. So coming to an end, all in all, we have to know where we are in this flow of evolution, of minimal invasive development. Where are we going to? Where are we coming from? Where are we standing? And with this, I wish us all an inspirative meeting, and I want to remember that future is a vector from the past. It is a vector from history. So if we want to understand where we are, we have to look to the history. If we want to know where we are going to, we have to understand the history. Thank you for your attention.